Diana? Voice.
AIDS stands for Acquired Immune Deficiency Syndrome. Each one of these words tells us something important about AIDS. The word acquired tells us that you can get infected with HIV. AIDS is not something that you can inherit from your parents, which means it cannot be transferred genetically. The word immune represents our immune system. The immune system includes all the organs and cells of the body that work to fight off the infections or diseases. The word deficiency tells us that a person gets AIDS when their immune system is deficient or stops working properly. A syndrome is a collection of signs or symptoms of diseases. AIDS is a syndrome rather than a single disease because AIDS is a complex illness with a wide range of complications and symptoms. AIDS was discovered in the year 1982 by Dr. JIROVECI, and Dr. It is diagnosed by testing the blood, saliva, or urine of the patient. This is done to test for the presence of antibodies produced against HIV. And this is for the causative agent of AIDS, which is known as HIV. It stands for Human Immunodeficiency Virus. HIV belongs to a special class of viruses called retroviruses. HIV is a retrovirus because its genetic material is made up of RNA, not DNA. It is placed in the subgroup called lentiviruses. That's because it attacks the immune system. Generally, HIV contains an outer envelope, which consists of 2 layers of lipids and contains 2 kinds of glycoproteins. It also contains a protein core, which is known as the capsid. The matrix lies in between the outer envelope and the protein core, and lastly, the double-stranded RNA is contained in the protein core, and it, along with 2 other kinds of enzymes, which are reverse transcriptase and protease. This virus acts on T helper cells, macrophages, and beta cells. So this is the structure of HIV, and as you can see, there are 2 kinds of glycoproteins, which are GB41 and GB120, and in the protein core there is double-stranded RNA and 2 kinds of enzymes, which are reverse transcriptase and protease.
Okay, so AIDS can be transmitted through 3 different mediums. Firstly is through blood, genital fluid, and breast milk. So genital fluid includes semen, rectal fluid, vaginal fluid. So HIV can be transmitted when these body fluids get in contact with the mucous membrane, damage tissues, or get directly injected into the bloodstream. For your information, HIV is not sprayed through air, water, or casual contact. So for example, if you are sitting beside a HIV-infected person and the person sneezes or coughs, you will not get AIDS through that transmission. And because HIV cannot survive in the body of insects, so even if the mosquito bites you, you will not get AIDS through that. So firstly, you can get HIV virus through having unprotected sex with an infected partner, either through vaginal sex, anal sex, or oral sex. Because the HIV virus is present in the genital fluids and can pass from either cuts, sores, or ulcers of the infected partner to the bloodstream. Likewise, for oral sex, the virus can pass through scrapes or ulcers in the mouth of the infected partner to the non-infected partner. Secondly, HIV virus can be transmitted through blood transfusion and organ transplant if a patient receives blood or organ that has been contaminated with the virus. However, organ transplant is now considered very safe because the organ donors are tested before they are allowed to donate their organs. Likewise, for blood transfusion, it is also safe in most of the countries because the blood collection procedures now are highly regulated and the blood donors are screened for virus before they are allowed to donate their blood. And after the blood is donated, it is also tested for infectious agents like HIV virus and it is also heat treated to kill any other viruses. Thirdly, HIV virus can be transmitted through contaminated syringe. This can happen during blood donation, tattoo, body piercing, or the injection of drugs. Syringe can get contaminated if sharing or reusing of syringe occurs during any of these procedures. So, sharing of equipment used to prepare drugs. For example, if the person reuses the container used to prepare the drugs and it has been contaminated with the virus can spread to the next person who is also using the same equipment. And reusing of syringe, cottons, and even the water used to rinse the container, it can transmit the virus through that same method. Okay, fourthly, HIV virus can be transmitted from mother to child, and this is known as vertical transmission. Vertical transmission can occur during three phases. Firstly, during pregnancy, childbirth, and also through breastfeeding. So the HIV virus is small enough to cross the placenta from the mother's blood to the fetus. Okay, during childbirth, if the mother chooses to undergo vaginal childbirth, the baby can get in contact with the infected blood of the body fluid. However, most doctors will recommend that the pregnant woman should go through cesarean delivery instead. And lastly, it can be transmitted through breast milk because the viral particles and infected lymphocytes are present in the breast milk. However, most HIV infected mothers will choose to use instant formula instead.
Right now I'd like to talk about the mechanism of action of the HIV virus. As my colleague Rosaline has said earlier, HIV can be transmitted through sharing of needles, blood transfusion, or tattoos, but I can say on a very low percentage. Just say. So after the HIV virus enters the body, the HIV virus attacks and kills crucial immune system cells known as T helper cells, or also known as CD4+ cells on a more scientific basis. These cells, the target infected cells, will be killed by cytotoxic T cells, otherwise known as CD8+ cells, and they also stimulate B cells to produce antibodies to kill infection. Moving on. This is how the HIV virus replicates. It does this by first entering the T helper cell. The HIV virus then uses an enzyme called reverse transcriptase to create a complementary DNA, or otherwise known as a viral DNA, of the host cell's RNA through a process referred to as obviously reverse transcription. This is how the HIV virus is then replicated in the host cell. Alright, now moving on to the death of the T helper cells. The infected T helper cells, or CD4+ cells, are then die due to a form of cell suicide. The replicated viruses are then spread out to infect other T cells around nearby areas. According to the analogy process, it's like a grenade, and the shrapnel is the virus DNA. It explodes, shrapnel moves around, infects other T helper cells. Without the T helper cells, many other immune system cells cannot work properly, as I stated earlier, such as B cells, cytotoxic T cells, macrophages. This then leads to the person having a high risk of infection, which is very important. Result: a person with HIV may not show any symptoms for years because after the HIV virus enters the T helper cell, it tends to remain dormant for a certain while until stimulated, where it then kills the CD4+ cells, explodes and infects other cells. As this happens, the T helper cells, the amount of T helper cells will slowly begin to decrease, reaching to a dangerously low amount. This leads to a higher rate of infection where symptoms will start to appear, hence the term AIDS. As my other colleague Diana has said earlier, AIDS is not a single disease, it is a syndrome. An example of a syndrome. Right. Thank you.
So now we'll be talking about prevention and treatment of AIDS. So to prevent AIDS from being transmitted to you, there are a few things you have to avoid. First of all, you have to practice safe sex with the use of condoms to prevent the body fluid from being in contact with each other. Secondly, you have to prevent sharing needles that have AIDS. Use sterile injection equipment. You also have to limit the amount of sexual partners you have, and avoid breastfeeding to your child to prevent the AIDS from transmitting to your child. And lastly, you have to avoid blood contact. For example, if you're helping a bleeding HIV-infected person, make sure the blood doesn't come in contact with your eyes, your mouth, or any open wounds. So there's currently no cure for AIDS because the virus transmits when its genetic code is being inserted to human cells. Therefore, when your human cells replicate, the virus does too. Having a healthy lifestyle will also help you to therefore prolong your lifespan of having AIDS. For example, having enough sleep, having optimum nutrition, and exercise. A more pharmaceutical way of treatment is undergoing the antiretroviral therapy, which has 3 types. The first one is reverse transcriptase inhibitors that stop the virus from reproducing. The second one is protease inhibitors that interface with the HIV protein that produces infectious particles in your body. And the last common antiretroviral drug is fusion inhibitors that prevents the virus from entering your healthy cells. Although these help prolong the AIDS-infected person's life, there are side effects such as nausea, vomiting, heart disease, and weakened bones. So there are both pros and cons to this. So the HIV patients will have a prolonged life up to 10 to 20 years with the help of antiviral therapy.
Others. AIDS is actually a global epidemic, and being a global epidemic, every country is affected by AIDS. However, more than 95% of HIV infections are found in developing countries. with two-thirds found in sub-Saharan Africa. Hovering over 28 million living infected with AIDS, with HIV, according to the World Health Organization. The infection is actually rapidly spreading in Eastern Europe and Central Asia, with an increase of 250% from 2001 to 2010. The large increase in Eastern Europe is largely due to an increase of injection drug users. Complications. Being a syndrome, as Diana has mentioned, there are many complications of AIDS, and here are some of the more common complications: tuberculosis, TB, candidiasis, THRUSH, pneumocystis, JIROVECI, pneumonia, BJP, and KAPOSI'S. Candidiasis is a fungal infection of, it can infect the mouth, throat, vagina, causing inflammation and a thick white coating on the mucous membranes. This infection can also get to the bloodstream and can be very dangerous for HIV patients. The symptoms are as such as stated: discomfort and itching. Yeah, that's about it.
And another thing is bad smell. Fungal on your mouth
Okay.
and the lower part.
Treatment would be proper hygiene, maintaining optimal blood sugar levels, and antifungal medications. Okay, PG.
PJP, yes.
Pneumocystis, JIROVECI pneumonia is a fungal infection of the lungs and is a complication of cancer and AIDS. PJP was actually a very rare disease back in the past before the discovery of AIDS, but after the discovery of the disease, it became a very common issue. And the symptoms are as stated: productive cough, breathlessness, fever, and rapid breathing. Yeah. And the treatment is antibiotics, antibiotics. KAPOSI'S SARCOMA. KAPOSI'S sarcoma is a type of cancer that mainly affects the skin, mouth, and the lungs, but can also affect other organs such as the lungs. KS is one of the most common causes of death in AIDS patients. And the symptoms are bluish, purple, or red hairless lesions on skin, and which may grow into raised bumps, and the patient might have issues with thing of swallowing, and will have nausea, vomiting, and abdominal pain, swelling, and serious coughing. And these are some of the features of KAPOSI'S sarcoma. This is really nice.
One in the eyes, yeah. Nice.
The social implications of AIDS. Sufferers of AIDS usually have to live with the stigma of how other people might treat them because of reasons. This is usually because most people are not educated on the basis of this disease and might avoid the people infected with AIDS due to reasons such as the fear of contacting the disease themselves. The same could be said for employment as well. Patients seeking for employment might be discriminated by their employers due to reasons such as low productivity and such. Sports. Although very uncommon, extremely uncommon, extremely rare, there have been cases where HIV has been transmitted from one person to another in contact sports such as football. The wounded person, the player, comes in contact with another wounded player, and there's a chance of the virus transmitting from that. Appearance. In cases where HIV has already developed to AIDS, physical alterations can be prevalent. Weight loss can occur, and some may develop skin lesions all over the bodies, which is also known as KAPOSI'S. Thrush can also occur on the tongue and inside the mouth. These may impact victims, as others might be judgmental and discriminate them. Relationships. Someone carrying the disease may find it difficult to start or even maintain an existing relationship. A victim will not be able to
will not be able to have intercourse without protection, and that would be killed. Yeah, some people might not like that. So yeah. Thank you.
Right. So,
I think so. Yeah, okay, so as you can see, some interesting facts about AIDS.
hello, everybody come in front.
Oh, yeah, fast.
Good Q&A session.
Yeah, in the South African prison system, the Church numbers gang uses rape by AIDS-infected inmates as punishment. So if you're being a not very nice person, you get raped with a guy by AIDS. Other cases such as New York, Lucian Williams, this guy is horrible, had sex with dozens, or maybe they think even hundreds of women after learning he was HIV positive, just to be a dick. Yeah.
Some people will do that.
More interesting facts. Hemoglobin featured in the DC comic The New Aliens in 1988, when their understanding of AIDS was still in its infancy. Hemoglobin was an HIV positive vampire used by a white supremacist group to infect minorities with the disease. So it's like a super villain with AIDS. He's a vampire. And then he had a superhero trying to stop him. His name was Extrano, and he was a gay superhero. And he managed to stop him before dying of AIDS himself. Moving on. Why is there still no cure for AIDS? HIV is a virus. It mutates in nearly every replication because the viral enzyme responsible for encoding new strands is not reliable. So let's say if you want to get some antibiotics in a person, but if the HIV virus keeps on mutating, the antibiotics will not be able to detect or recognize those new replicated viruses. Hence, it cannot cure it, according to my understanding. Not very reliable. But here we have to take into account every strain, every cell, and every environmental context.
Good. Finish the slide. This is continue. Okay. Another one. Yes. Okay, come in front, shoot the questions. Who wants to be prison in the South Africa?
Yeah, who wants to be a prisoner in South Africa? Ask some questions.
Hey guys, come in front lah, show your face. Camp order is there. Yes, any questions? Come on, don't worry. Don't worry, you guys already finished presenting your questions. That's it, no question.
Yes!
Chillax! Q&A is a part of what we call presentation. In your universities, your friends won't be so nice to you. Yes, Adam?
Are gay people more likely to get AIDS than straight people?
I think that department is for...
Yes.
Department.
Last time it used to be between men and women sex, right? However, now there's men to men sex and women to women sex. And recent studies show that this homosexual sex has a higher risk of HIV transmission than the normal man to woman sex.
Let me then explain to you one of the common theory. This is not a proven theory, but this is more like a theory by the scientists. They say man and woman sex, okay, I mean the normal sex, okay, usually what happens is it is protected in such a way that it prevents most of the disease. Because you see the semen and the vaginal fluid, they have their own protective mechanism. Certain bacteria living inside the vaginal fluid actually prevents other viruses or bacteria from spreading. That is why what happened, it is more unlikely to get a disease, I mean compared to a gay sex, okay? Gay on the other hand, they are immune to each other. Understand? So for example, guy and guy, they have no protection or whatsoever. So it's more likely to get. Okay, so doesn't mean, let me repeat this, doesn't mean you're HIV positive, you have sex with some guy or some girl, doesn't mean 100% you will get, the other guys or girl will have HIV. It is just a possibility, probability. But don't use it as an excuse and go and, oh, it's a probability only. Understand? So any other question? David?
That's a bro.
Yes?
How masculine? How transgender?
Huh?
Transgenders.
This is my
Your department now.
my theory on why gay to gay sex is more easier to transmit. My theory, okay, this is not scientific.
Coming from your
It's
theory.
because the dicks are so vast and hard, right? Like when it shoves inside the asshole of another gay person, there tends to be some bleeding, I think. You know, based on my experience. And transgenders will probably not based on my experience.
Basically what he's saying is true because the anal sex are more painful, involve blood. So AIDS compared to semen and vaginal fluid, they like blood more, so you get infected easily.
How's it?
Okay?
Stay
When
ready.
the child is grow faster. Okay, go.
Thanks.
Yes, cholera. Oh, what's that? Wait,